Okay, this is the cranial nerve testing. We'll start with cranial nerve 1, the olfactory. I want you to close your eyes for me. I want you to close your left nostril and tell me what you smell.
Cinnamon.
Okay, and do the same with the right nostril. Tell me what you smell.
Coffee.
Okay, cranial nerve 1 is intact. Cranial nerve 2, optic nerve. So I'm going to have you tell me whenever you see my fingers in your field of gaze.
Now. Now. Now.
Okay, cranial nerve 2 is intact. Now we're going to test cranial nerve 3, oculomotor, trocar, and abducens. So we'll start. I want you to look at my finger here. Keep your head steady. Look at my finger, and with your eyes, just follow. Don't move your head. Okay, hold steady here. No nystagmus noted. I'm going to cover one side here. Cover, uncover test. Okay. No abnormal movement noted in the eyes. So now we're going to test cranial nerve 5, the trigeminal nerve. First, I'm going to have you just relax here. I want to palpate the masseter and the temporal, and they're normal, not asymmetrical, equally strong. And now we're going to do a light touch test. So give me your hand here. So this is what you're going to feel. Tell me whenever you feel this. Close your eyes.
Now. 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 Now.
Okay. So now we're going to test sharp and dull sensation. So this is going to be like a dull.
Okay.
And this is going to be sharp.
Okay.
So I want you to differentiate between the two.
Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay. Cranial nerve 5 is intact. And then we're going to move on to cranial nerve 7, which is facial nerve. So I want you to make a big smile for me, frown for me, and then raise up your eyebrows real big, and then go ah.
Ah.
Okay, cranial nerve 7 is intact. Now we're going to test cranial nerve 8, which is the oculovestibular and ocular cochlear and the auditory nerve. Okay, so I want to do a Weber test. Tell me when you no longer hear this. Close your eyes.
No.
Okay, hearing is intact bilaterally, and then now we're going to do a Rene test. So I want you to tell me I'm going to place this on the masseter bone. I want you to tell me whenever you no longer feel this vibration. Close your eyes for me.
No.
Okay. Again.
No.
Okay. So the conduction ratio is about a 2 times bone to air. And then we're going to do on the left. Or the right, rather.
Okay. Now. Okay. Now.
Okay, Rene test is passed, and that conduction was about 2 times bone to air. Okay, and then we're going to test cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve. So we're going to start. I'll grab a tongue depressor and I'll here, and then I want you to open up really wide for me. Okay, and then go ah.
Ah.
Okay, I can see the uvula was elevated. So now we're gonna test for our swallow reflex.
Okay.
Swallow for me. Some water.
Okay.
Okay. Swallow is intact. And then I'm just gonna, it's gonna be a little uncomfortable. I'm just gonna reach back here. Okay. Gag reflex is intact. Okay, that was cranial nerve 9 and 10. And then we're gonna do test next. We're gonna test cranial nerve 11, which is the spinal accessory. So I want you to resist whenever you, I want you to shrug your shoulders like this and resist me here.
Okay.
Okay. And then we're gonna do the same thing. I want you to push backwards against.
Okay.
Okay. And then I want you to do the same here.
Okay.
Same here.
Okay.
And then towards me. So strength is about 5. So cranial nerve 11 is intact, and then cranial nerve 12 is the hypoglossal nerve. So I want you to stick your tongue out for me. Go up, down, side to side. Okay, and then I want you to push to the left of your cheek with your tongue. Okay, and the same for the right. And the strength of that is about a 5, so cranial nerve 12 is intact.